is Dr. Sanjay Shah. We'll be talking about regenerative medicine treatments for the spine. The spine is a very complicated structure with a lot of nerves. You can almost think of it as, I like to think of it as almost a circuit breaker of your home. This is where all of your nerves, all those wires, they coalesce in one location, and from there they're distributed to the rest of your body. Now, if these nerves get irritated in any way, if they get damaged in any way from herniations, from arthritis, you've probably heard of sciatica, then what happens is you can have a lot of pain in your back and the pain can go down your legs. Just to give you a simple anatomy lesson over here. So this is your spine. It's broken up into cervical until the blue here, and this whole blue part is called the thoracic spine. The green part is called the lumbar spine. This orange part right here is the sacrum. And you can see there are little nerves that come out of every level of the spine. We will focus more on the lumbar, but every level of the spine is very similar in terms of all of the treatment options that we have. So typically when you have sciatica, one of these nerves in the lumbar spine is affected. And you can see over here, if you look closely, that there's a herniation. So you can cause a mechanical obstruction on that nerve. That nerve gets irritated, and then in the entire distribution of that nerve, you can have pain. So for example, this is the L3 nerve right here that's herniated. So you look at your trusty diagram over here at L3, you can have some discomfort in your lower back, and it can radiate down into your thigh. L4, radiate across your knee. L5, down your lower leg to your foot. S1 can go into the back, into your calf, and into the outside part of your foot. So, what treatment options do we normally have? Typically, with steroid injections, what you can do is place a needle over here into the epidural space, or place a foraminal injection, is what we call it, very close to the nerve, and that'll take away the inflammation around the nerve. With regenerative therapies, what we're able to do is take platelets or take stem cells depending on the severity of your pain, and we can actually inject the platelets or the stem cells in close proximity to the nerve to take away the inflammation and to heal the nerve. But we can also inject them into these joints. These joints are facet joints. They often develop a lot of arthritis, they swell, and they also press on these nerves. They also cause a lot of back pain. We can actually inject stem cells and platelets into your discs. We can inject stem cells and platelets into the ligaments of your spine, because oftentimes over time this becomes very unstable and this whole apparatus can move. When that happens, you can have a shifting of your spine where one of these bones goes in front of the other, a common condition known as spondylolisthesis. Whichever condition you have, if you stabilize the whole apparatus, stabilize the ligaments, take away the inflammation around the nerves, stabilize and help rejuvenate the muscles, these are called the multifidus muscles in your spine, and if you make sure that the ligament is not as thick by injecting the ligament with platelets, what you're doing is you're doing a global approach to treating your lumbar, thoracic, or cervical pain, taking away the inflammation, increasing the stability, making sure you decrease the progression of your sciatica, your arthritis of your spine, or any other disc pathology that you may have. This will in turn decrease pain, allow you to be more active, and it'll affect downstream, it'll affect your joints. The spine, like I said, is the control center. It affects your hips, it affects your knees, it affects your feet, it affects every part of your body. The same way the cervical spine can affect your neck, affect your shoulders, your shoulder joints, your elbows, and your hands. So the spine is very critical in maintaining the balance of your whole body and every joint in your body.